infectious diseases, research, medicine, health. Welcome to Outbreak News Interviews. And now, broadcasting from the Outbreak News Skylar Studios in beautiful West Central Florida, here is your host, microbiologist and editor of OutbreakNewsToday.com, Robert Harriman.
Well, hey everybody, this is Robert, and welcome to Outbreak News Interviews. Now on today's podcast, I wanted to look at the once pretty common, highly contagious disease, chickenpox. And joining me today to answer some questions about chickenpox is Donald Kaye, MD. Dr. Kaye is a professor of medicine at the Drexel University College of Medicine, and he's also an associate editor at the very popular website ProMed Mail. Dr. Kaye, welcome to the show, sir.
Thank you.
So, Dr. Kaye, what is chickenpox and what is the varicella zoster virus?
Chickenpox is a contagious viral disease that is caused by a virus called the varicella zoster virus because it causes varicella, which is chickenpox, and it causes zoster, which is shingles. It formerly was a disease essentially only of children, or the great majority were children, and now in the United States anyway, it affects people who are older too in terms of developing chickenpox. And of course, herpes zoster, or shingles, has been with us for many, many years. That has not changed, and that occurs mainly in older people.
So how common was chickenpox before the vaccine, and how common is it today?
Before the vaccine in the United States, and I want to point out that in many parts of the world, vaccination against chickenpox is not common, or at least a great majority do not get vaccinated. In any event, before the vaccine availability in 1995, before that, in the U.S., 90% of the population developed chickenpox, and they developed it before the age of 15, so that we had about 4 million cases a year. Now it's been cut down to less than 10% of that.
Now, it's a pretty mild disease, typically. However, that's not always the case, is it?
No, in infants and in pregnancy and in people whose immune systems don't work properly, it can be very severe. It can be lethal. And as a matter of fact, it's a much worse disease in adults than it is in children. So protecting children and not protecting the entire population so that adults don't get it who have not been vaccinated can be counterproductive because if adults get it, they have a much greater chance of needing to be hospitalized and developing severe complications. Children who don't have immune diseases do very well with chickenpox generally. It's a very benign, mild disease.
And it's a pretty contagious virus. Dr. Kaye, how is chickenpox transmitted?
Actually, about 9 out of 10 contacts who are not immune of a patient with chickenpox will develop chickenpox. So yes, it's very contagious, not as contagious as measles, but very contagious. And it's transmitted by the airborne route, and it also by direct contact with the skin of somebody who has the skin rash of chickenpox.
And clinically, as a physician, how does chickenpox present?
In the usual case in the child, and again, these have become much less common, but the usual case in the child who has no problem with their immune system, there may be fever for a day or two and some feeling of not being well. There may be none of that. And then the rash develops. And the rash starts off as flat red spots that develop quickly into bumpy red spots, which then develop into blisters. And they occur primarily on the face and the body, sparing the palms and soles.
And very few physicians today have actually seen a case of smallpox. How does the chickenpox presentation differ from smallpox?
Yeah, smallpox has been eradicated in the world. There have been no cases in many years. I happen to have seen quite a few back in the days in foreign countries. And it's a much more severe disease with a significant mortality rate. The rash is somewhat similar, but does tend to involve the arms and legs more heavily than the body. And in fact, there is a rash on the palms and soles. There is no more smallpox, and there won't be unless in a biological attack.
So what is shingles? You mentioned shingles earlier. And how is chickenpox linked to shingles later in life?
In the initial case of chickenpox, the virus does not go away after the rash goes away, and it persists in the nervous system, primarily in the nerves along the spine, in the bodies of the nerves along the spine. And then, years later, when some level of immunity is lost, they can actually reactivate if they've just been sleeping there or latent for many, many years, and travel along the nerve and cause a rash, which tends to occur on one side of the body, and the rash is with blisters, and there are multiple blisters in one area on one side of the body, left or right.
Now, diagnosis of chickenpox is primarily based on symptoms. But Dr. Kaye, are there any times when lab diagnosis is required?
Lab diagnosis would be required in the cases where you are concerned that it could be smallpox, that there may have been released from a laboratory purposefully or not purposefully, such as in a biological attack. And there are occasional other cases of rash that looks like chickenpox and acts like chickenpox. We had a number of cases in this country about 10 years ago of monkeypox, which looks just like chickenpox. It was derived from some animals that were imported from Africa.
Now, treatment for chickenpox is supportive, I imagine. Is there any time that specific treatment is necessary?
No treatment is necessary in children from the age of 1 to 15 who are in good immunological shape. However, it can be a very severe disease in infants, pregnancy, and adults, and of course those who have immunosuppression or whose immune system doesn't work properly. Those people can develop very severe disease and should be treated And we do have antiviral agents that are quite effective in treating them if the treatment is started relatively early, within the first few days.
Can you talk about the vaccine and the successes of the vaccine?
The vaccine was developed in 1995, and it was effective in preventing about 20%, about 80% of cases. Sorry, it was 80% effective, and then it was realized that with just the one injection, that there was this 20% failure rate. And therefore, in 2005, it was recommended that 2 doses be used. And with 2 doses, it can be as high as 98% effective. There are still some cases that will occur.
Some of us that are old enough, even some young people still, know of things called chickenpox parties. What are chickenpox parties, and is that a good or a bad idea?
Well, this is sort of the same situation as with measles. There are those very uninformed people who feel that a debunked scientific result that was published about autism from vaccination and has thoroughly been disproved since it was published, feel that vaccination is bad and should be avoided. So they used to get children together who had measles or chickenpox or mumps to purposely spread the infection. It's not a good idea for a number of reasons. Number one, these diseases can kill infants who may be exposed to somebody who developed it at that party, or somebody at the party may have an immune deficiency that they don't know about, or adults may be exposed who are not immune, where it's a much more severe disease. And the other thing is that if you never develop chickenpox, you'll never develop herpes zoster or shingles, which can be a very, very unpleasant disease, which develops later in life. It'll only occur in those who've had chickenpox. So developing chickenpox is not a good idea if you can avoid it. And you can avoid it in the great majority of cases by getting immunized. Well
said. Dr. Kaye, any final thoughts on chickenpox, shingles, or the vaccines?
Get immunized. Get your children immunized. There is absolutely no downside of getting immunized with these vaccines unless you are immunosuppressed, if you have one of the diseases that can cause immunosuppression, which are cancer and as well as leukemia and various other immunologic diseases.
Well, very well said. And I want to thank you, Dr. Donald Kaye, for sharing your time and your expertise with us today. Thank you, sir.
You're welcome.